Welcome to Good Governance. My name is Kevin Mooney. I'm going to talk to you about responsible AI and a little bit about me to frame my experience in this area. I've been at the Cleveland Clinic for about 20 years in various leadership roles. I am an attorney by trade. As a lawyer, I built, chaired, and managed the IT IP legal group practice for a pretty long stretch, handling a lot of unique high-tech initiatives. The analytics team were some of my clients, and in that regard, the need developed to build and manage a data governance office. So I was asked to pivot over from my legal role and into this new greenfield to build our data governance practice, of which I am currently managing. I also have a cybersecurity background, having served as cyber counsel, and this is important only in that you will see these three disciplines converge to inform our approach on how we actually govern AI. All right, to set the stage today, I want to share my personal position related to responsible AI with a general statement, and that is this. Any organization that does not invest in responsible good governance as an equal side of the same coin to the science of AI is patently, on its face, irresponsible. This is true on many fronts. And if you think about it in this way, how can any organization know that it is adopting good science? How can they know that it is compliant with existing and emerging law? How can they know that it has mitigated against bias and discrimination, or know that it has adhered to security best practices, all without governance processes, guardrails, and the informed culture to guide it? The answer is simply it can't. So who in their right mind would then create an irresponsible AI program? The answer is pretty simple. Those companies that do not govern AI, those are the ones that are going to be irresponsible. If an organization is going to build or invest in AI technologies, they should first govern what is to come. If they cannot or they will not do that, they should just refrain from developing AI. We know this reality here as an institution, and I'm going to discuss how we have built responsible practices into our AI activity. First, I want to set the scene a little bit in the United States in particular, where most, but not all of our operations reside. So the healthcare space itself in the US in particular, to me, is a very fascinating industry. It's got a lot of nuances and complexity. If you look over here on the left of the slide, our costs within the industry are equal to approximately 20% of the gross domestic product of the United States. That means that our costs are out of control. We have a constant need for cost containment and new strategies. We also need better patient outcomes at higher quality rates and at lower costs. Further, within the entire ecosystem of healthcare, we have a lot of different types of players with sometimes inconsistent goals. So we have providers, we have payers, we have insurance companies, we have high tech and low tech, we have cybersecurity professionals. We also have cyber criminals. And certainly at the centerpiece of everything, we have the patients themselves. Within that ecosystem, you'd think that we'd be pretty good at coordinating. But at times there is a lack of coordination, both within organizations and also across the industry and core functions. That could include billing, healthcare operations, or actual clinical care. Lastly, we have new tech that is exploding within the healthcare space. In line with that, we also have overstretched budgets and pretty thin margins. On the provider side, with a lot of 501c3s in particular, our margins are pretty thin. And so our burnout rates can be a little more substantial than other industries for a lot of reasons, but that's one of them. All this means is that all of this can lead to a lack of empathy. So the industry sees these patient experience impacts all the time. Doctors are spending more time on tech and less face time with their patients, for instance. And in this slide, you can see, we'll take Patty, the patient here, as an example. Perhaps she's been waiting an hour and a half for her physician, who might be in the next room, banging on the keyboard, using ChatGPT with prompts like, how can I increase patient experience? And now that example might be a little funny, It's not really that far-fetched. We have doctors who are increasingly being tasked with administrative technical detail, and that has led to some distance with the patients themselves. So overall, we have this very complex industry that is constantly pointing for a need for innovation to drive down cost and to produce better outcomes. So enter the stage, artificial intelligence. We are right now in the midst of an industrial revolution. And if you think about what industrial revolution means, this radical scientific and technological transformation that is upon us right now with this novel technology. So what do we do with it? AI needs to be harnessed and unleashed in a very rapid, thoughtful, governed manner with patient prominence and safety uppermost in mind. We need to fuel the engine of progress with good governance to accelerate that innovation is the cornerstone of this presentation. That's going to begin with the strategy. And from that strategy is going to come the establishment of accountability policy and associated processes. That includes standard, repeatable, measurable approaches across your entire enterprise. We also have core ethical principles, which will need to be enforced through these standards. A couple of examples of that would be human intervention and judgment, particularly when we're talking about clinical care. I'll tell you also, an organization can really empower itself internally by going externally, is what I meant to say. We can enhance our capabilities within our organization, partly by collaborating with those external parties. That includes the government, adding our voice to the national debate. And lastly, I will make a little note on this front. There is a core best practice of any such strategy to do your best to future-proof the models with evolving law and regulation, as technology continues to be a promise for positive change, but it also continues to outpace regulations. So this is the environment that we're confronted with. And I want to give one last note on this idea that there's sometimes a misperception of governance and its place with artificial intelligence. And we hear these voices from time to time. That for me, there's a really an unnecessary perceived conflict and tension between governance and innovation. I think this misperception is actually created by applying governance passively and more in a disconnected manner. An organization can just eliminate this perceived gap by simply proactively leaning into it. So this means the organization uses the structure of governance to create the actual innovation. They are one and the same. And in that way, you can leverage the great promise of AI for the betterment of patients and society in a more seamless manner. So that's our backdrop from which we need to start building out this responsible AI program. I'm going to give you one more piece of the background, which is being associated with the context of the healthcare industry. We do have governmental pressures that are impacting society at large, but in particular for this podcast, healthcare. Because of the advent of these tools and the rapidity of development, as many of you know, the White House has issued a call to action in this space. So there has been an executive order that attempts to do several things, one of which is hardening the frameworks here in the US. But it's also attempting deeper involvement and collaboration with key allies in other nations. We have a lot of frameworks around the world. We have many frameworks within the United States itself, and it's getting pretty confusing. So some of this needs to be streamlined. Now I'll give you, if you look at the bullets on the left-hand side of this screen, you can see some of the summaries of the goals within that EO, and they're hitting on these ideas of accountability, equity, civil rights, trustworthiness, privacy, security. This is a true ecosystem call to action, not just with congressional leaders and with international players or our federal agencies, but the IT community itself, where we want a much deeper commitment to accountability as they continue to advance in this space. On the right-hand side, I've put some acronyms down from that represent the federal agencies that have been implicated within this executive order. And I'll just point out one of them, NIST, which is our National Institute of Standards and Technology. As part of their call to action, they've engaged in what they call the AI Safety Consortium, which is a cross-industry group that is an outcropping from this executive order, meant to pull together and get to governance 2.0. So they do have an AI risk management framework that is being reviewed and enhanced, partly as a call to action here. Now, not to be forgotten in this executive order, which is largely based in the United States, we have our European partners. So we know that the EU AI Act is now in the books, and I call that out because it's important to remember that Europe's processes are going to continue to collect on our shores. An example of this in general that some of you have seen is GDPR. And its influence on a dozen privacy laws at the state level here in the US that either follow or borrow from GDPR itself. The same is going to happen with European laws impacting us here in the US related to AI. I'll give you one quick example of this, where there's this constant influence. Recently, very recently, the FDA has aligned its medical device good manufacturing practices with international standards. So this, not to get into too much detail, it relates to the FDA's quality system regulations that now incorporate by reference several international ISO standards. Again, that's just an example of the convergence that is occurring with the world's best and most sustainable practices. So now we've got the government weighing in on this, and I want to show you one particular agency. We just talked about the FDA. So taking the FDA as an example of a regulator that is impacted by this continuous evolution, and really just one dimension in this space in healthcare, by looking at one regulator, we can start to glean out a picture of what's coming. So we know there's thousands of AI algorithms in the pipeline. Some of those are being brought to the FDA's attention and some are not. In general, when algorithms are considered software as a medical device, they're going to be regulated. And this slide represents that regulated environment of medical devices that are AI-based. So radiology, by its nature, is always going to take a leading role in this space, and that has been true over the last 4 or 5 years, and it continues to be true. I have some numbers here. You can see 2022, 2023, and then a jump. But I'll tell you that somewhere around May of 2024, the FDA had approved or cleared about 882 AI ML enabled devices. More than 150 of those devices received their marketing authorization somewhere between August of 2023 and the end of that March 2024 reference of time. Now, since that time, in just a few short months, that number has jumped up to 950. So what we're continuing to see is this acceleration of these models and the review by the FDA for clearance of these models as medical devices. So if you think about that at the macro level, with all of this activity, our response to the explosion of tech and AI, looking at the problems in healthcare, looking at the opportunity of harnessing innovation and the challenge of mitigating risk, our answer to that is the establishment of a dynamic, multi-stakeholder, engaged governance framework. So the centerpiece of this framework is a cross-stakeholder accountable mechanism that we affectionately call the AI Task Force. So I'm going to introduce you to our task force. And our vision here related to AI, like many things, is always that collectively working together, we are going to be much better off and we're going to better the whole as we go down these roads. So this is our AI task force in concept. This is the foundation of our trust framework. So what is it? It's a formal structure for decision making, for documentation and execution of AI. It is established and empowered under our artificial intelligence policy. It is the accountability mechanism, as I've said, for the enterprise related to our AI activity. The task force itself is going to oversee the development of underlying AI programs, including coordinating the developing AI strategy and evolving our governance as we continue to get better in this space. The task force is administered by my team on the data governance side, if you look at the left-hand side, but it is being administered in conjunction with our data science team. And we did that on purpose. So we sit as co-chairs between governance and science because we have very different disciplines that converge together, create a really great streamlined approach to this. So my governance team will do the things that you would normally see a governance team doing, which is managing the process and ensuring repeatable, measurable standards are in place and organizing and helping with the decision making through this AI task force. While the folks on the right, our data science team, we want them to do what data scientists do, which is very consultative in nature, looking at the elements of our model framework, which I'll get into in a minute, and also encouraging rigorous testing and validation. So as we do this, around the center, you'll see a circle of activity, and this shows some of the activity that the AI task force is engaged in. Ultimately, our goal is to govern to the least extent required while providing the right level of guardrails to facilitate innovation. So through this task force, we can start aligning our objectives and our decisions. And always at the core of this trust framework is that there's a balancing act of using responsible practices to accelerate AI innovation. And we're doing that ultimately for the betterment of our patient population itself. So again, here, because we've organized the people and we've got an empowerment of diversity of opinion and experience and thought, we can actually get into what we want to do, which is allowing nimble governance and providing better patient care and really funneling our best use cases that we can pick from to ride the best horses moving forward. As we're doing that, if you look at the bullets on the right-hand side, these are the tenets of a true governance program. And I'm calling out a few of these. I'm going to talk about a policy. I've just mentioned the AI task force. We do have a model development framework I'm going to get into in a minute, as well as our ethical principles of practice. So you can start to see how this framework develops based on getting the right people at the table. So here is, as of the date of this recording, our AI task force. Again, it's co-chaired between governance and science, and it's really this diversity-empowered governance model that is so important. You can see the diversity of roles here. We've got representation from your usual suspects in legal and cyber and compliance and ethics, but we also have our IT folks, in particular, our folks related to clinical integration of AI within our IT stacks, as well as representation from analytics. And we have a hospital that many of you know about in London, a really prestigious hospital, and we have representation overseas to make sure that we have a consistent practice across the globe. So through this diversity of opinion that we bring to bear, our scope within that committee really focuses on a few things. One, internal model builds. Number two would be external third-party models. Three is activity around novel models like generative AI, which has been all the buzz over the last year and a half. And number four, really managing those external consortiums and relationships that I will speak about in a moment or two. So we have robust debate, we have dialogue, we have discourse, and we have decision-making around this space. And that means we can also pend projects, or we can stop them altogether until specific corrections can be applied. It's a very powerful way to do this. So as fully organized under the task force, this is what the strategy really starts to look like. Now, I'm going to go into further detail in a moment in some of these areas, but I wanted to show you a visual of how this strategy comes together to activate AI. And we do that through these stacks. So we have, again, this framework that I'm going to show you, some ethical principles and policy and engagement within consortiums. These are the tenets of a good, solid program. So the fullness of the structure also helps us operationally as we continue to further orchestrate activity, which includes building out our operations. So in order to be a really highly functioning AI shop, you've got to have the tech to support it. Because we've got a strategy in place and the structures by which we can manage that evolving AI story, innovation does have other operational dependencies. So this includes, if you look at the top left, building out both a tech and a data foundational infrastructure. Obviously, we need compute, we need tools, we need fit for purpose data to address the velocity and vigor needed for these AI applications. It's also important on the right-hand side to upskill the scientists around the enterprise and to give the organization the consultative support that they need to ensure that the standards are actually applied consistently. On the bottom right, lastly, to really empower a true AI revolution, it's going to be important for providers who are largely in the business of wellness and for caring for the sick to engage with the right AI-driven partnerships across that health tech landscape. So if you think about the leveraging of big tech with an organization that has one particular expertise, with a provider who has a very, very different expertise, can be a very productive arrangement. So all of this activity, as you're building out the infrastructure and the support to be a much more nimble AI shop, all of this activity can be coordinated through that AI task force. To give you one more view on the subject matter of third parties, since I just touched on that, I'm going to pivot slightly and give you examples. Instead of a health tech partnership, now we're talking about consortiums. So here's a few examples of some of these third-party engagements that we've been engaged with. And again, the idea here is that we are stronger internally by going external and sharing among other parties and consortiums. So we can both influence the national and international dialogue by ensuring our voice is heard in that regard. But we can also learn and keep a fresh eye on best practices that we can adopt ourselves. Quick nod to the top left here with NIST, again, our National Institute of Standards and Technology. The AI Safety Consortium is a consortium that is across industries, and it is engaged in really trying to develop new age tools to improve trustworthiness and responsible AI. And we have representation within that consortium currently, and it's been very productive. Another example of this at the bottom right is CHAI, the Coalition of Health AI, which has been a really great tool over the last several years. This is a very specific healthcare industry focus, and it's pulled together a lot of academic health systems to really harmonize those standards that we all need to engage in when we're using artificial intelligence within our provider space. So with all of this activity, I want to point out, again, just a few other core mechanisms that I've alluded to, and I've promised I'd talk about, that the AI task force is using to ensure good governance. And right at the top of this, to really have the empowerment of your organization, is going to be your umbrella policy. So our umbrella AI policy establishes several key functions of authority for the enterprise. So these include the establishment and the empowerment of the AI task force, number one. Number two, the establishment of a true center of excellence of data science. Number three is the creation of foundational ethical principles that need to be embedded into models. And number four is the establishment of the model development framework into which various stakeholders will play a part or who can add their specific requirements at different stages. I will tell you that there's various other policies and procedures that will flow from this umbrella policy, and that's what wrote it like that. A great example of that is the advent of generative AI. We have a generative AI procedure that flows down from that master AI policy because of the novelty of that technology. So we have this policy that is the umbrella, and that can actually help us enforce other parts of the governance program. So here is what we call our AI guiding principles. And again, this rolls up to the overarching policy, and it's another core mechanism that it's going to end up being unique to each entity, but consistently across industries, a lot of folks are using different chapters like this. And so you're going to see a redundancy across different stacks and different companies with what they think their ethical guiding principles are. These just happen to be ours. So these principles are designed to ensure that model development is done in an ethical manner, making sure that these principles are always part of the equation. So I'm going to point out a few. If you look at the top in the second stack, there's a reference to patient transparency. I make this call out because there is currently a national debate as to whether and when a provider has an ethical obligation to provide notice to a patient when AI has been used as decision support in a clinical setting. Now, we are part of that national debate, and at this point in our history, we tend to agree that there are going to be times when patient transparency is an ethical consideration that we need to adhere to. That is a very different equation than on the far left up corner of model transparency. And you may have heard of model transparency, I'm sure, the need to ensure that there is explainability within the algorithms. This is sometimes referenced as black box algorithms, and those that lack explainability, those are going to continue to be heavily scrutinized as the laws converge and coalesce among the leading international players. In Europe, this is already an issue. It's already heavily scrutinized related to black box technologies. So as an ethical guiding principle, we need to take that into consideration as we do our builds. Another example that I feel is really important, on the far right in the middle row, there's a box called human intervention, this idea of a human in the loop. This is another area where we are guiding our ethical obligations by ensuring that a human is interpreting the output from AI and making professional and critical judgment calls based on that human experience in the process, rather than relying upon the AI tool to make decisions for the physicians. So there may be some nuances to this with non-clinical, low risk operations, but in general, the idea of autonomous AI activity is not currently permitted. So these are our ethical considerations, and there are others. These are just the touchstones and the primary ones that we look at, outlined on this slide, that are a key component to our responsible AI and how we conduct our building of our algorithms. I'm going to take that a step further with the building out of these different models. And another facet that we developed for responsible AI is to guide the organization through model development by taking traditional data science playbooks and infusing it with two things. One is permitting key stakeholders to engage within the different stages of model development. And number two, using frameworks like the NIST standards to embed those voluntary principles into our processes. So at the top left, we have the NIST AI Risk Management Framework. It has 4 primary chapters: govern, map, measure, manage, and it has multiple sub-pieces underneath those. You can see in the center, this image is noting the fact that we've merged those with the playbook on the right and the chapters that you would typically see within a model development phase with the different algorithms. So Again, this is a voluntary framework, but when you apply these frameworks, you bring much more clarity to the picture. You have much better touch points with bias and discrimination and all the other ethical issues that could come up in developing models. But you also have an overall better legally defensible position because you are thoughtful enough to actually embed some of these practices. I'm going to call out the other two at the bottom on the left. NIST does have a cybersecurity framework, 853. They also have what they call 800-218, which is their software development framework. So because we're looking at this within the framework of actually building the models on the front end, we're going to be in a much, much better place. So you have to get creative with it. You have to link an organization's capabilities and its culture with the intended outcomes and also its risk tolerance. Regardless, doing something like this and linking out frameworks and certainly linking to the regulations and linking that all to the science that's being developed is critical for safe and effective practices. So I want to show you this slide where we are building out playbooks and show you how we actually impact the model development framework. So now we have this framework. It's linked to that playbook. It's infused with those NIST standards and opportunities for stakeholders to address certain areas of concern. This is now spread throughout the actual model development framework represented by this slide. And you can see 5 basic stages that we've demonstrated here. And this process flows from the inception of an idea all the way through model production and maintenance. So quickly, if you look at a model proposal stage, it's what you would think it is. You're looking at the problem and the goal definition. Do we have similar models that we've already reviewed, or are they in existence? What's the benefit? What are the basic risks? What's the return on investment if we go down this road? What are the basic, really basic data and ethical considerations we can start looking at in that first cycle? When you get to the second, this model development phase, we're looking a little deeper at the data discovery and what the model will look like. Also looking at data collection and the types of data that's potentially going to be ingested into the algorithm. We'll ask questions about integrations and APIs and where it's hosted. And it really starts fleshing out that overview of the model itself. Now here we do we notch up a little bit into our ethical and peer review. So when we get to that third cycle of true peer review and validation, we're looking at things where it makes sense, like social bias reviews. We definitely do a much deeper patient risk assessment at this stage. We're looking at how the model's going to perform and trying to predict some of the mitigation techniques we're going to need before we go into production. And we have a very, very deep peer review at this stage. Once we get into pilot and production, which is going to be after the final legal and ethical requirements are approved, you just do your typical production type activity with version controls and bug fixes and continuing to run the system appropriately. One of the most important things, though, is the last cycle. So building out a command center for monitoring the model behavior and tracking the behavior of the models is really important. Looking at the degradation over time, looking at new ways to mitigate issues that are developing within the actual life of that model. We also do outcome analysis here and ongoing audits for vulnerabilities, for instance. So you have, at that point, a lot of structure around the model development phases, and all the right people have been at the table to be able to have their input. So to activate this life cycle that I'm showing you, it really needs a starting point. So I'm going to show you the intake process that we developed. So this is our process to funnel projects and ideas through that model development life cycle. It's both an intake process, but it also functions as gates throughout that process. And again, this is where legal and cyber and my team, ethics, compliance, can weigh in with their particular discipline. So in this way, we ensure the data science team is supported along with the caregivers who have actually developed the use case. But we also ensure the important functions of cyber by design, of privacy by design, of legal by design, of governance by design are all there on the front end. And again, I'm going to say it twice. An example of this would be the cybersecurity team influencing data science builds with NIST 800-218, the security software or the secure software development framework. Another example would be legal having a very particular requirement that needs to be built into the process. We don't want to talk to that legal team in the 11th hour. We need them at the table at the beginning. So that's the entirety of the program. And I would like to tie this all together and conclude with a couple of thoughts. So significantly, AI provides the potential to transform healthcare. And we do that by deriving new, timely, accurate, and important insights from the vast amount of data generated during the delivery of healthcare. This we know can lead to better, more accurate, faster care for patients. It can also help address the tremendous amount of waste in healthcare that I showed in one of the first slides. Ironically, we can also teach a new generation of doctors to utilize new tools while still maintaining professional judgment in reviewing their outcomes that are produced in those models. So ultimately, AI can have a positive impact on patient experience. And I want to end with this, that patients first, this motto of patients first, is a way of life at the Cleveland Clinic, not only as the foundation of clinical care, but also related to how the enterprise defines the holistic relationship to the patients that are served. Patients first includes not only the culture of caring, but also ensures that patient information is used and disclosed appropriately and securely protected, including being used with the right advanced analytics models to maximize their care. At the core of that patient-caregiver relationship is the platform of trust, and we ensure this trust through our governance structures. So therefore, it's critically important that AI be rolled out responsibly and in a governed manner. And again, to close, I'm going to reiterate that we've organized a governance structure to manage AI innovation under our task force. We have provided guardrails for safety and responsibility through policy and process. We use a milestone-based AI framework to develop, standardize, implement, and monitor models. We have a model development that is shepherded by a multi-stakeholder group with diverse backgrounds that's led by data governance and data science. We have cross-stakeholder feedback and peer reviews that serve to mitigate against bias and discrimination. And we are ensuring proper integration of the right models into clinical practice through rigorous and vigorous evaluations. So collectively, across disciplines and very proud to say, led by our AI task force, in this all-inclusive environment, we are truly providing good governance, specifically to accelerate that AI innovation. I really hope this information has been helpful. Thank you very much.